Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
There is a follow-up question for you, Dr. Hrkal, in the chat. They just don't want their voice recorded. So during last week's Q&A, they asked about their mild thyroidism and the effects it could have on her recovery. TSH is 5.3 with negative TPO antibodies. Recently, I read an article read the increase of iodine deficiency in Canada, and I'm wondering if iodine could be a factor. I never eat out and very rarely add any table salt to cooking or food at home. I do, however, have eggs or fish several times per week each and a fair bit of dairy daily. Would I likely be getting enough iodine from these foods? What is the best way to test for this? I have read that there is a skin test that you can do at home to assess iodine levels, but it is not very accurate. Question for Melinda afterwards. I have recently heard of a technique called havening. Do you have any experience with this?
It's called havening. Yeah. All right. So let's talk about thyroid here for a second. So it sounds like from the TSH, that's the thyroid stimulating hormone. That is a brain hormone that's secreted by the pituitary gland to basically in response to the levels of thyroid hormone we have in our bloodstream. So when thyroid levels go down, hormone levels in the bloodstream, the TSH kind of goes up to compensate. So it does sound like this person has a slightly underactive thyroid because the TSH is elevated. Anything over 2.5, so between 1 and 2.5 is the ideal range. So anti-TPO antibodies are the autoimmune reactions and it's negative, so that's a good sign. That means your body's not attacking the thyroid, which could be one of the reasons you could have a sluggish thyroid and elevated TSH. Iodine is one of the key minerals specifically for your thyroid for the production of thyroid hormone. It's essential for it to properly work. Now, iodine was added to the general food, to a number of different foods, primarily table salt. Again, this was done in the early 1900s to prevent something called goiter, which was, a well-known deficiency of iodine that caused the thyroid to swell because, again, the thyroid is trying to compensate for, hey, we got to produce more thyroid hormone, so let's increase the amount of tissue making thyroid hormone. And so what happened here is that it started becoming fortified to prevent these deficiencies because there isn't a lot of foods that have a lot of iodine in it. The main food groups are fish and crustaceans, so like shrimp and different types of fish will have some iodine in it. The best vegetarian source is going to be sea vegetables, so things like seaweed, kelp, nori, kombu. There's a whole list of these vegetables, and it's actually one of the factors that has been associated with longevity that's experienced within certain groups of people around the world. There's these things called blue zones. One of them is one of the most famous ones is on the rural parts of the islands of Japan. Okinawa is one of the famous ones, and they are famous for eating some seafood, but definitely some sea vegetables as being a key part of their diet. And that actually, as a bit of a side note, there's some evidence to show that it offsets the negative impact of soy products because soy products can actually make your thyroid more sluggish, along with something called the cruciferous family of vegetables. So certain foods are called goitrogens, and they basically make the thyroid not as efficient and not as effective. So this was a long preamble to get everybody on the same page, but to answer your question now directly, is that iodine can be tested, and you can do a hair mineral test for iodine. There is something called a iodine skin test, where in a doctor's office they kind of paint on a bit of an iodine solution. It looks like something that is very bright, like kind of like a dark orange or brown. That's the typical kind of tincture of iodine that's used as an antiseptic, same type of color. And then they basically are tracking how long it takes to be absorbed in your skin. If it disappears in a short period of time, it may indicate that you're deficient. Now, I think I don't use this test in my practice. Clearly, by the description, I'm not giving you this real big details here, but I think that is not a very accurate way of testing it necessarily. I prefer to test through hair, and that's a way of seeing if iodine's deficient in a more accurate way. It's a reflection of what's going on in the tissues. But I think in general, the last thing I'll say is that I think people have been scared into avoiding things like salt because of the heart issues associated with salt. And I think a lot of that's been majorly overblown. So we've heard of sodium, and which is sodium chloride, is connected to increasing hypertension or blood pressure. And this actually only occurs in a small subset of sodium sensitive people. So it's not like everyone that's listening to this is automatically sensitive to salt. That's not the way this works. And because salt in North America, at least, has been fortified, meaning iodine's been added to table salt to prevent that whole deficiency. But now, because people are avoiding salt because of all the heart issues, they might become more deficient in iodine. Iodine deficiency is one of the more common deficiencies in the world, and it actually can become problematic in things like pregnancy, conception, fertility, children, especially if they are really avoiding any sort of those foods I mentioned, including, I think, having good electrolytes, which salt is a part of, I think can be helpful for people, especially if they have lower blood pressure, if they have dysautonomia. Electrolytes can be really, really valuable. So hopefully that's giving you a little bit of background and also insight about, I think a question that a lot of people are asking about their thyroid, but also specifically the mineral iodine.
Yeah, Paul, I'm glad you mentioned about sort of the dysautonomia, because I know a lot of members here have this sort of like autonomic dysfunction. And if that's combined with low blood pressure, I'm aware that sometimes salt is actually a key component of supporting that. Is that right?
Totally, yeah. And it can be part of a therapeutic approach. In fact, some of the leading researchers in the world on autonomic dysfunction and conditions like POTS and dysautonomia and orthostatic hypotension, which is low blood pressure, or orthostatic tachycardia, where your heart rate goes up. Electrolytes, and again, sodium, potassium, magnesium, and chloride are all part of those, part of the electrolyte family, can play a really important role at stabilizing autonomic function. So I think that idea around salt is bad for everyone, we should avoid it, is too general. I think there's some specific people with high blood pressure that are sensitive to salt. Some people have water retention with salt. They should be more careful of it. But otherwise, the type of salt, I think, makes a big difference. Most people's salt intake, Melinda, is related to processed foods. That's where you're getting it. Like, the third ingredient in ketchup, for example, is salt. It's very high in sodium. It's also very high in sugar. This is where most people are getting the very base level of salt. I think if you're now getting it from a sea salt source, if you're getting it from something like, let's say, Celtic sea salt, you're going to get the whole array of minerals that come along with sodium. And I think that's going to get you a lot more therapeutic benefit. And so, yeah, I think that we have to be careful of not overdoing the dangers of salt, because I think it's been way overblown.
Great. Melinda, have you ever heard of havening? They were also wondering.
Right. Yeah, I've loosely heard of it. It's not an evidence-based technique as far as I'm aware. It is similar, sounds similar, and has some similar concepts to EMDR, which is eye movement desensitization reprocessing. I had to think about that, or EMDR, which is a trauma processing therapy technique. And the general idea is to use like a neurological approach to reprocessing trauma. So In EMDR, they use eye movements as a way to sort of process traumatic experiences and remap them, excuse me. Havening, I don't know too much about what it's like, but it does sound quite a bit like EMDR. And the intention of it is to help support you to ground and stabilize your emotions, help support you if you're overwhelmed by a traumatic experience, and give you some sense of relief from symptoms, psychological, emotional symptoms that can occur following a traumatic experience. Of course, here we only really talk about evidence-based modalities, so that's why I'm referencing EMDR instead. I think that's kind of a good summary. I don't know if you guys at the Pain and Wellness Center, Dr. Paul, do you guys use havening or no?
No, unfortunately, I've never heard of it before, so I can't really comment on it. I mean, there's techniques that come up around the peripheries, around like slight different permutations of some of the other existing techniques. Some of the existing techniques also, they're pretty restricted with like where you can get the training, and I think that they've been monetized, and so I think some of these other providers are maybe looking to create their own little thing sometimes. We've seen this in the chiropractic profession, for example, where something called muscle release technique, MRT, is the general version, and there's active release. But active release is you have to take the course with this one provider that has like a monopoly on it because they've restricted that name and title and they've trademarked it. So, I mean, I think your point is well found, where it's like there are similar techniques, but they may not be the exact one. But we can really speak to all the evidence-based ones and the ones that we use with our practice.
Yeah, and EMDR is a huge science-based, evidence-based technique. So if you're looking for something to try as far as trauma processing, I would recommend looking into EMDR. It looks like they have trademarked havening. I just did a quick Google after you said the question because I wasn't quite sure. But that doesn't mean it's evidence-based. It looks like there's very little literature around it. So taking a peek maybe at the EMDR, seeing if that's a good fit for you. Not that you can't try havening, but not something we can really speak to here.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.